My name is John Flett. I'm a pediatrician passionate about helping parents, teachers, and families with ADHD, emotional difficulties, learning difficulties, and related problems. Recently I've seen a lot of my patients coming in who've had lots and lots of previous tests. They've had problems at school, and unfortunately, sometimes by the school, by psychologists and therapists, they've been advised, and even by other doctors, pediatricians, to have enormous tests because there's a problem with their child. They've been admitted to hospital with lots of blood tests, had extensive investigations, scans on the brain, 24-hour EEGs. And from a parent's point of view, if these things are advised, and particularly if you don't understand what causes ADHD, you think, well, there must be a reason. I can't see the problem. ADHD, you can't see. So often these tests are kind of performed. People think, well, my child's got low iron, they're lethargic, they've got low thyroid, they've got, they're tired. Why are they so tired? They're so exhausted. They don't have energy, not concentrating. I don't see any problem. Maybe it's the diet, maybe they've got preservatives, maybe they've got allergy problems. And these cost enormous amounts of money. And to a certain degree, unnecessary. Clearly, there are problems related and medical problems related, but they are so rare. You know, Parents often think, maybe my child's got a hearing problem. So there are lots of tests that maybe need to be done in certain circumstances, but ADHD is a genetic neurochemical problem. The less experienced, the less somebody understands ADHD, the more tests they do. So my advice to parents is go to somebody who's an expert, who can look at everything and not spend your money unnecessarily. I feel I'm almost like a medical broker. I've got to be able to spend parents' money in the right way, efficiently, without being dangerous and missing problems. There certainly is a role to do tests. Just this last week, I saw a child who had some symptoms that were kind of a bit weird, had been to their GP, the child had been choking a little bit, had postnasal drip, been put on some allergy treatment, and yet the child had woken up with these symptoms, almost choking. Now, the parents phoned me and said, look, is this related to the ADHD medicine? They'd never had this before. And I knew immediately that this was not the case. This child probably has a form of epilepsy that happens during adolescence, something called benign relentic epilepsy. So there's a case that child needs treatment and needs investigation. There are many cases where the children need investigation. So, I see, often teachers who don't have that background, or even psychologists, advising parents to have all these tests done when it's not their area of expertise. My advice is go to somebody who understands that before you embark upon a tangent and a sidetracking of expensive, unnecessary tests. But what I would say is go to your doctor first if you are really worried about those tests. But, to go and randomly do those tests without a real fundamental understanding and the importance of them is often an expensive waste of time.